So for our case study, we did Brazil, and the population in Brazil is 207,353,391 people as of 2017. Brazil is the fifth largest country in the world based on population, and a large concentration of people live along the Atlantic coast in the east, although the main places people live are near the cities of Sao Paulo, Brasilia, and Rio de Janeiro. The main reason is because of the water, because they need water to survive. And then a population pyramid provides insights about political and social stability, and usually the shape of the pyramid gradually evolves over time based on the fertility and mortality. So for Brazil, the pyramid shows a long life expectancy for a population that is between expansive, and stationary. This means that there is more younger people in this country than there are older people. Brazil is in stage 3 of the demographic transition model. It has a natural increase rate of 0.73%, and there are 14.1 births for every 1,000 people of the population. There is also 6.7 deaths for every 1,000 people. The main reasons it went from stage 1 to stage 2 is because of farming, and from stage 2 to stage 3 is because of development in technology and economics in 1970. As of 2016, for the total population, the ratios were 0.97 males for every 1 female. This means that there's 96 males for 100 females. At birth, there's 1.05 males per females. There's from 0 to 14 years, there's 1.04 males to females. From 15 to 24 years, there's 1.03 males to females. And 25 to 54, 0.98 males to females. 55 to 64, there's 0.89 males to females. 65 years and over, there's 74.74 males to females. Based off of this information, as the years go on, more males die, which means that women typically live longer than men. For the whole country, the number of females is roughly equal to the number of males living here. This provides a very stable economy and allows for the population to continue to stay stable, because there, like in this map up here, there is Russia has less than 0.95. There are more girls than boys, so there will be less men in the workforce, and there will also be less men to um, make the women pregnant or whatever. So there um, there could be a chance of the population be declining because of the less birth rates.
Maternal mortality rate. The maternal mortality rate, or MMR, is the annual number of female deaths per 100,000 live births from any cause related to or aggravated by pregnancy or its management, excluding accidental or incidental causes. The MMR in Brazil is 44 deaths per 100,000 live births as of 2015. The country comparison to the world is 103. This means Brazil's maternal mortality rate is average or moderate. I can tell that their MMR is moderate if I compare it to the US and Chad. The US is very advanced in medicine, which means our rate should be smaller, which is 14 deaths per 100,000 births as of 2015. Chad's MMR is more than 1,000 deaths per 100,000 births. This also tells me that Brazil's recent generations of women are strong and healthy compared to many other countries. Dependency ratio. The total dependency ratio is the ratio of combined youth population, ages 0 to 14, and elderly populations, ages 65 and up, per 100 people of working age, ages 15 to 64. Brazil's total dependency ratio is 43.8. This means that Brazil has a low total dependency ratio. A low total dependency ratio indicates that the recent generations are healthier, stronger, and are economically independent. A high total dependency ratio indicates that the working age population and the overall economy face a greater burden to support and provide social services for youth and elderly persons, who are often economically dependent. Because Brazil has a low total dependency ratio, they will have less health care services such as nursing homes. Infant mortality rate. This entry gives the number of deaths of infants under 1 year old in a given year per 1,000 live births in the same year. This rate is often used as an indicator of the level of health in a country. Brazil's total infant mortality rate is 18 deaths per 1,000 live births. Males average at 21.2 deaths per 1,000 live births. Females average at 14.7 deaths per 1,000 live births as of 2016. Its country comparison to the world is 94. Brazil has a moderate average infant mortality. Because Brazil has a moderate IMR, this shows that it is a mostly healthy country. This is due to previous healthy generations and the medicine in Brazil. The male MIR is higher than the total IMR, and the female IMR is less than the total. This shows statistically that females are healthier than males in Brazil.
8.3% of the GDP, or gross domestic product, goes to healthcare services. The comparison to the world is ranked 51. Healthcare services go to hospitals such as air conditioning or other medical equipment. 70% of Brazilian residents use public hospitals, while the rest of the people use private hospital visits. The people either pay for themselves or their medical insurance covers it. Foreigners may use private hospitals, but they will be charged for their visit. The GDP of Brazil is 1.796 trillion. Hospital bed density is how many hospital beds are in an area. Hospital beds include inpatient beds, which are available in public, private, general, or specialized hospitals or rehabilitation centers. 1.85 physicians per every 1,000 population. Around 2 physicians for every 1,000 population is not very many. This can cause thousands of people to die because they are not getting the proper help. Also, this means that Brazil is having trouble training and teaching students about becoming physicians. Maybe school in Brazil is too much for them to study, or maybe it is hard to find jobs in that field. 2.3 beds per every 1,000 population. There are around 2.3 beds per every 1,000 people. This is not enough beds to hold sick people. When we look at the statistics of people living with HIV and AIDS, there is not enough hospital beds or physicians to help these victims. It can take months to get an X-ray in Brazil. Their health care laws cause this problem. They have free public health care. 0.6% of adults in Brazil carry HIV and AIDS. Brazil, compared to the rest of the world, they are ranked 11th place with people living with HIV and AIDS. 830,000 people living with HIV and AIDS are in Brazil. The people living in the northwest side of Brazil have a higher chance of getting HIV and AIDS than the people on the south side. 14,000 people have died because of HIV and AIDS. Brazil, compared to the rest of the world, they are ranked 18th, which is not very good. This means that they have quite a few people die a year from this disease. 22.1% of adults are obese. Brazil, compared to the rest of the world, they are ranked 102. This means that they do not have very many people that are obese, therefore they will have healthy habits. 22.2% of children under the age of 5 years are underweight. Brazil, compared to the rest of the world, is ranked 121st, which is good. This means that they do not have very many children that are underweight. This also means that children are healthy and getting the nutrients that they will need to live.